Thank you, moderator. And the United States would like to applaud the leadership of Secretary General Ban Ki-moon, President Sampaio, and President Karim for convening this historic meeting. I just wanted to make 3 quick points because we're running late and there are a lot of other comments. The first point is that TB and HIV programs and implementation globally has demonstrated workable and effective models and in development and health generally, and we need to be utilizing those models and speaking about them. Secondly, the HIV and TB communities have an obligation to work in partnership. And third, it is in the interest of the HIV and TB communities to work in partnership. In terms of the first point, that it is the TB response and HIV response has demonstrated new models for effective development with accountable targets and results, with effective implementation that builds systems. You cannot do TB effectively, care and treatment, without building systems. You cannot take care of a chronic disease, prevention, care, and treatment of HIV without building health systems, including human resource systems, supply chain management systems, communications, logistics, and other systems. The second piece of what we're doing is not just accountable targets and effective health systems building, but it is building what President Bush has called a new era in development, in which we move beyond the flawed and failed approach of donors and recipients to an era of true partnership between equals, and in fact one in which we in the international community begin to recognize our relationship as the junior partner to the countries in which we serve. Country ownership is the key, and where HIV and TB plans have been going the last several years, and we have some tremendous examples from today from the leaders of those plans who have talked about them. There are national plans which all sectors, government, non-governmental, faith, and community-based organizations are engaged. And so we should talk more about these effective models and utilize these models not only for health, but for development in general. Second point, that we have an obligation to work together. Everywhere we have the obligation to share lessons learned, to discuss those key successes in implementation from our successful programs. Secondly, where appropriate, and Dr. Piot was quite correct that it is not always appropriate, but certainly in sub-Saharan Africa, we must work hand in hand with HIV and TB, because without that, we will not save more lives. As we've seen, we're doing very well in many places. Mrs. Kagame, His Excellency the President have spoken about success in their programs, and we've heard from others as well, success from civil society in Kenya. But we can do better. But together, under country plans, the UN family, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, PEPFAR, civil society, and other partners have stepped up to support country plans, and so we are seeing success. 3-1, Stop TB, the 3 I's. PEPFAR alone has quintupled its resources for HIV-TB over the last 3 years, and we hope to do even better. Part of doing better is to look for synergies. I was recently in one country that has an excellent Stop TB program, and the HIV community was actually resistant to utilizing that as a platform to expand HIV services. I've been in other countries, and I have to say the multilaterals and bilaterals were just as much a part of that as anyone else. And I've been in other places where the HIV community is not open to working as closely with the TB community. That simply will not solve the problem. And at least in sub-Saharan Africa, we should begin to recognize more and more that the care and treatment of HIV is the care and treatment of tuberculosis. The two are interlinked, and we cannot succeed in one without the other. If you ask a person suffering in a village or in a city if they'd like to respect bureaucratic lines of reporting and authority, or if they'd like effective services to save their lives and the lives of their people, we know what their answer would be. And so that should be our answer as well. The third point is that it is in our interest to work together in the HIV and TB community. There's been much progress to date, but we need much more. If we cannot link the HIV and TB worlds, which are so closely linked together, we cannot link any areas of development effectively or any areas of health. And if we do not work well in the field, if we do not use the foundations and platforms that are being developed for chronic diseases and for other diseases for care and delivery systems, if we do not do it in the field, we will cede precious time and effort to ever-increasing debates, meetings about vertical and horizontal programs that will sap not only our time and effort and energy, but in the long term, it will sap political commitment and resources. So those 3 points, that HIV and TB are models of implementation that we need to utilize, that we have an obligation to work together in partnership, and that it is in our interest to work together in partnership, are the points I wanted to make. I hope that we can grasp this unique opportunity in time, that we can continue to dare to dream, have the temerity to hope, and the courage and openness of spirit to break down barriers and preconceived notions, to work together in partnership in the service of others, and in so doing change the world, because working together, everything is possible.